Welcome to the deep dive. Today we're taking a stack of clinical reviews, retrospective case series, and some really cool experimental studies to answer one, well, massive question about this current skinimalism trend.
Yeah, it's a trend that's really everywhere right now.
It really is.
Yeah.
And our mission today is to figure out if you can effectively and, safely combine uncross-linked hyaluronic acid skin boosters with cross-linked fillers.
Right, doing both at the same time.
Exactly. To treat both that surface skin crinkling and the deep structural volume loss. Because, you walk into a modern aesthetic clinic today, and you are immediately handed what looks like a wine list at a Michelin star restaurant.
Oh, absolutely. It's totally overwhelming.
Right. But instead of Cabernet and Pinot Noir, it's this massive, incredibly dense menu of injectables.
Yeah.
You've got dermal fillers on one page, skin boosters on another.
Barrier revitalizers, hybrid gels, the list goes on.
Yeah. And people who are chasing that flawless, poreless, dewy, glass skin look, they often just hit a wall of technical jargon. And they leave feeling, honestly, more confused than when they walked in. So, okay, let's unpack this.
Let's do it. To kind of cut through that clinical noise and provide a definitive answer on how these injectables actually interact, we've pulled together some highly illuminating evidence.
I have really great stuff in the stack today.
Yeah, we'll be analyzing a retrospective case series on multimodal midface augmentation. That one is by Dr. Karishma Balani. Plus several comprehensive clinical reviews on tissue regeneration.
And we even have that experimental data mapping out the composite nanoneedle delivery systems, which is wild.
It really is. Our goal here is to demystify the mechanical and biological behaviors of these materials beneath the surface of your skin.
So most of you listening already know this star player here, hyaluronic acid, or HA. It is the hero ingredient in nearly every hydrating serum on the market right now.
Oh, for sure. You can't walk down a skincare aisle without seeing it.
Right. But to understand how a clinic can use it to build like a firm cheekbone on one hand and then smooth out a superficial surface crinkle on the other, we have to look at how this molecule fundamentally operates inside the human body.
We do. And a single HA molecule possesses this it's an unbelievable biological superpower, honestly.
Yeah.
It can attract and bind up to 1,000 times its own weight in water.
1,000 times. That's crazy.
Yeah, it basically acts as the body's ultimate biological sponge. And from an anatomical perspective, an average adult human has about 15 grams of this naturally occurring HA distributed throughout their tissues.
And it does a lot of heavy lifting, right?
Oh, absolutely. It lubricates your joints, it maintains the shape of your eyes, and, provides massive hydration to your dermal layers. But the biological catch is the speed of its metabolic turnover.
Meaning how fast the body breaks it down.
Exactly. You degrade and synthesize about 1/3 of your total HA every single day.
Well, 1/3 of it every day.
Yeah. Native enzymes, they're called hyaluronidases. They're basically constantly sweeping through your tissues, breaking down the old HA to make room for the new.
It's like a relentless biological cleanup crew.
That's a perfect way to put it.
So if a practitioner were to just extract that natural, free-flowing liquid HA and inject a large volume of it deep into your face to try and, rebuild a jawline.
Those hyaluronidase enzymes would metabolize it almost instantly.
Right. The liquid would disperse, and the structural shape would just vanish in a matter of days, which is kind of useless if you're paying for a cheekbone.
Exactly. Which is why biomedical engineers introduced the process of chemical cross-linking.
Okay. Let's get into the chemistry a bit.
So to create a dermal filler that can actually support tissue, manufacturers take those native HA chains and introduce a chemical cross-linker, the most common one being BDDE.
And that stands for, let me check my notes, 1-phenyl-4-butanediol diglycidyl ether.
You got it. Yeah, BDDE. What it does is act like microscopic scaffolding. It creates strong, permanent chemical bridges between those free-floating HA chains, turning what was a fluid into a stable, three-dimensional network.
So I like to picture it this way, and tell me if this analogy tracks. Think of natural, uncross-linked hyaluronic acid like liquid cake batter.
Okay, I'm with you.
If you pour it onto a baking sheet, it just spreads everywhere. It's entirely fluid. It has no inherent structure.
Right, just puddles.
Yeah. But when you add that BDDE crosslinker, it's the equivalent of putting that batter into a hot oven.
Oh, I like that.
Right. The heat creates the chemical bonds, and suddenly you pull out a baked sponge cake. It holds its shape, you can sculpt it, and it strongly resists breaking down or falling apart.
What's fascinating here is how that metaphorical baking process, So the specific degree and density of the cross-linking fundamentally changes the physical properties of the gel.
Okay, how so?
Well, in fluid dynamics and rheology, we measure this property using the elastic modulus. It's commonly referred to as G prime.
G prime, okay.
Right. So a high G prime means the resulting gel is highly firm and firmly resists deformation under pressure. It essentially acts as a structural pillar.
Like a dense pound cake.
Exactly. Whereas a low G prime means the gel is softer and more malleable. By chemically tying these molecules together into a dense 3D network, we essentially hide the HA from those hungry hyaluronidase enzymes.
So the cleanup crew can't get to it as easily.
Precisely, allowing the gel to survive and hold its shape in the body for vastly longer periods.
Okay, so now that we've established how we get our sponge cake, the firm, highly cross-linked HA, we can explore how it addresses the first half of today's mission, which is treating deep volume loss.
Because aging isn't just about the skin losing its elasticity, right?
Exactly. It's a literal, three-dimensional structural collapse of the facial anatomy, which sounds terrifying, but it's just biology.
It is deeply mechanical degradation. It heavily involves bone resorption. Over time, your skeletal structure actually shrinks and, well, rotates.
Rotates. Wait, your bones rotate.
Yeah. A prime example is posterior maxillary shift. This is where the upper jawbone physically recedes backward and inward.
Oh, wow. I had no idea the skull actually changed shape like that.
It does. And simultaneously, the deep fat pads that sit on top of that bone, they begin to atrophy, they compartmentalize, and they physically slide downward due to gravity.
So everything is just kind of losing its anchor.
Right. The combination of the bone pulling back and the fat falling down is exactly what creates the visual of sunken cheeks, heavy jowls, and those deep shadowing folds around the mouth.
It's basically a crumbling foundation.
Mm-hmm.
And that is exactly where the high G prime cross-link HA fillers come in to play the role of the new scaffolding.
Exactly. To correct that structural collapse, practitioners inject these tightly cross-linked fillers incredibly deep into the facial planes.
Like how deep are we talking?
We are talking about the subcutaneous layers or even supraperiosteal placement, which means laying the filler gel directly on top of the receding bone.
Right on the bone.
Wow. Yeah. And because the gel has such a high elastic modulus, it works entirely through mechanical displacement.
Meaning it physically pushes things out of the way.
You got it. It acts as a physical wedge, literally pushing the overlying fat and muscle tissue upward and outward. It restores the projection and the contours that were lost to that skeletal degradation we talked about.
And we actually have some incredibly clear clinical evidence mapping this out in our stack today.
Yes, the Bellani study.
Right. Dr. Karishma Bellani published this really compelling retrospective case series looking at multimodal mid-face augmentation. So she tracked 5 patients ranging in age from 35 to 50 who were all experiencing moderate to severe mid-face volume loss.
Those classic sunken cheeks and flattened profiles, right?
Exactly. And her protocol utilized specific, highly cross-linked products from the Restylane portfolio, specifically Restylane Lift and Volime, targeting that deep projection.
And the results of placing that cross-linked matrix at the bone level are highly sustainable.
Because of the BDDE bridges.
Right. Because those chemical bridges form a physical protective barrier against the body's natural hyaluronidase enzymes, a structural filler placed at that depth can last anywhere from 6 to 18 months.
That's a long time.
It is. It provides reliable, sustained mechanical support to the face.
But, okay, I am struggling to picture this looking natural in a real, moving face.
What do you mean?
Well, if this cross-linked gel is basically a hardened, enzyme-resistant sponge cake, wouldn't it just look like a golf ball sitting under the skin? I mean, nobody wants an augmented cheekbone that looks like a piece of rigid plastic when they smile.
That's a very valid concern, and that brings us directly into the clinical application of rheology.
Okay.
A highly skilled practitioner does not apply a one-size-fits-all approach to the entire face. They meticulously select varying gel densities for different anatomical zones.
Oh, so they mix and match the G prime.
Exactly. You absolutely require a very firm high G prime gel to simulate the rigid edge of a bone along the jawline.
Right, because bone is hard.
Right. But for a highly mobile area like the nasolabial folds or the cheeks, the practitioner selects a much softer, more flexible, cross-linked gel.
So it moves with the muscles.
Exactly. It still provides lift, but it bends and integrates smoothly with the muscle tissue when you animate your face. But it's important to remember these cross-linked fillers are strictly designed for large-scale shape change and deep mechanical lift.
Right.
They are entirely incapable of fixing widespread skin texture issues on the surface.
Okay, so the deep filler successfully fixes the sunken cheek. But if the skin draped over that brand new, beautifully projected cheekbone still looks like, crepe paper.
The overall illusion of youth and health is completely ruined.
Exactly. So how are practitioners fixing the canvas itself?
Well, they pivot away from the cross-linked structural gels and utilize the second tool in the arsenal, skin boosters.
Okay, skin boosters.
These rely on uncross-linked, or very minimally stabilized, hyaluronic acid. Because the goal is no longer to build a structural pillar, we discard the dense sponge cake approach. We want the free-flowing liquid batter.
But how exactly are they getting this fluid batter into the skin? I mean, you certainly can't inject a massive pool of liquid deep down on the bone and expect it to do anything.
No. Instead of a deep bolus injection, skin boosters are delivered directly into the superficial or mid-dermis.
So just right under the surface.
Exactly, the upper living layers of the skin. Practitioners frequently use a mesotherapy technique called nappage.
Nappage.
It involves administering dozens of tiny, precise, highly superficial microinjections across the entire treatment area.
Dozens of them. That sounds a little intense.
Well, because this raw HA lacks those BDDE cross-linking bridges, it has an incredibly low G prime. It possesses basically zero structural integrity.
So it doesn't form a lump.
Right. Once it is microinjected, it disperses freely, evenly, and rapidly through the extracellular matrix of the skin.
Okay, but I have to ask the obvious question here. If this fluid is completely uncross-linked, the body's natural cleanup crew, those hyaluronidase enzymes, they're going to metabolize it in a matter of days or weeks, right?
Oh, yes.
So why would anyone endure dozens of painful needle pricks to their face for something that vanishes so quickly? Why not just spend that money on a really high-end, luxurious topical moisturizer?
That's the logical leap a lot of people make. But a topical cream, regardless of its price tag, faces a formidable biological barricade known as the stratum corneum.
The stratum corneum. That's the dead skin cells on top.
Yes. It's the outermost layer of your skin, composed of dead, flattened cells stacked like a brick wall. Its entire job is to keep environmental threats out and moisture in.
Okay, so the cream just sits on the bricks.
Exactly. Topicals generally cannot penetrate this armor to reach the extracellular matrix. And the extracellular matrix is the deep, jelly-like biological scaffolding where our living skin cells, like fibroblasts, actually reside.
Right.
When you use a needle to physically bypass the stratum corneum and inject uncross-linked HA directly into that living dermal layer, you are triggering a massive cascade of biological responses. It's known as mechanotransduction.
Mechanotransduction. Break down what that actually looks like at the cellular level. Yeah. Because that sounds like a big buzzword.
It does. So the physical presence of the injected fluid creates mechanical pressure inside the dermis. This physically stretches the fibroblasts.
Wait, it physically stretches them? Just by being there?
Yes. You can think of fibroblasts as microscopic spiders sitting in a web. If the web gets pulled and stretched by the sudden influx of HA fluid, the spider perceives it as an environmental signal that the surrounding structure is under stress and needs reinforcement.
Oh, that's wild. So they think they're under attack.
Or at least under structural strain. So the fibroblast wakes up and immediately starts spinning new webs. In this case, synthesizing brand new, natural collagen and elastin fibers.
So it essentially operates as a biological alarm clock.
That is exactly it. Furthermore, the HA molecules chemically bind to specific surface glycoproteins on your skin cells known as CD44 receptors.
CD44 receptors, okay.
Yeah.
This binding triggers intracellular signaling pathways that promote cell proliferation and survival. So even though the physical liquid HA you injected is metabolized and cleared out relatively quickly, the biological restructuring it provoked persists.
Because the factory got turned on.
Right. The localized factory production of fresh collagen and elastin persists for many months. It fundamentally improves the skin's inherent elasticity, it smooths out the superficial crinkling, and it delivers that highly sought-after radiant glow from the inside out.
So it isn't just a temporary hydrator at all. It is an active biostimulator.
Exactly.
And this synergy brings us directly to the core of our mission today. Can you layer these two treatments? Can you safely secure the deep structural support of the cross-linked filler while simultaneously treating the canvas with the dewy, crinkle-free finish of the uncross-linked skin booster?
The clinical consensus from the provided literature is an overwhelming yes.
Awesome.
In fact, combining these modalities represents the bedrock of modern aesthetic philosophy, which dictates structure first, skin quality second.
I love that. Structure first, skin quality second.
And from a safety standpoint, there is absolutely zero chemical danger or negative cross-reactivity in mixing them.
Right, because at the end of the day, despite all the lab engineering, they are both fundamentally just hyaluronic acid.
They are the exact same core molecule. They share an identical safety profile. And, crucially, if an adverse event were to occur, both the cross-linked gel and the uncross-linked fluid can be safely and rapidly dissolved by injecting synthetic hyaluronidase enzymes.
Ah, so you can manually send in the cleanup crew if you need to.
Exactly. So the clinical debate does not center on whether you can combine them, but rather on the specific protocol used to sequence the treatments.
Yeah, and looking at the data, clinics generally divide this into two main protocols, right?
Right.
The first is the same session combination, and this involves the practitioner placing the firm structural filler deep down on the bone, and then in the exact same appointment, performing the superficial skin booster microinjections across the entire face.
Right. And while patients heavily favor the convenience of a single clinical visit, who wouldn't? The literature generally recommends reserving the same session approach for exceptional experienced practitioners.
Because it's too much at once.
Pretty much. The heavily preferred route in the clinical data is the spaced session approach. This prioritizes safety and precision over convenience.
Okay, so under the spaced protocol, the patient receives the deep structural filler first, leaves the clinic to heal for, 2 to 4 weeks?
Yep, about 2 to 4 weeks.
And then returns for the superficial skin booster.
So why does spacing the appointments out yield a better clinical outcome?
It entirely comes down to the practitioner's ability to perform accurate visual assessments.
Okay.
When you utilize the nappage technique with a skin booster, administering dozens of tiny fluid deposits into the superficial dermis, it causes immediate, widespread surface swelling and inflammation across the face.
Because you just poke them dozens of times. Exactly. Think of it like tailoring a bespoke suit. You must first construct the rigid shoulder pads and let them set perfectly in place.
Oh, that makes sense.
If you try to tailor the delicate drape of the exterior silk fabric while the shoulder pads are still shifting and swelling, your measurements will be completely distorted.
Yeah, you wouldn't tailor the silk over shifting shoulder pads.
Exactly. By letting the deep filler settle for a few weeks, the practitioner ensures the structural foundation is completely symmetrical and stable before they begin addressing the delicate surface texture.
Okay, here's where it gets really interesting to me. Think about what we're accomplishing by thoughtfully layering these two distinct engineered molecules. We are literally mimicking the exact multidimensional way the human face is age.
Oh, absolutely.
Right. We lose dense bone and fat deep down, which the high G' cross-linked filler expertly replaces. Simultaneously, we lose hydration and elasticity on the superficial canvas, which the low G' uncross-linked booster rebuilds. It is an exact anatomical match for the aging process.
If we connect this to the bigger picture, it underscores a massive paradigm shift within aesthetic medicine.
How so?
For decades, the industry was myopically focused on isolated spot treatments. A patient would walk into a clinic, point at a single isolated wrinkle, and the practitioner would merely chase that specific fold with a syringe.
Just playing whack-a-mole with wrinkles.
Exactly. But we are finally moving away from that reactionary approach toward holistic, multimodal tissue regeneration. Practitioners are now treating the face as a complex, layered, three-dimensional ecosystem.
It's so much smarter. But,
Yeah.
If sequentially layering these treatments in space sessions is proving to be this profoundly effective, researchers must be in a lab somewhere trying to streamline the process.
Oh, they definitely are.
Are they finding ways to deliver both the structural scaffolding and the superficial hydration at the exact same time, effectively bypassing the need to book multiple painful clinical visits?
The frontier of this biomedical research is progressing rapidly. Our sources highlight a particularly fascinating experimental study focusing on composite nanoneedle delivery systems.
Nanoneedles. So we are talking about something resembling a specialized patch you would simply press onto your skin.
Exactly. The researchers successfully engineered a microneedle patch, which they rigorously tested on both mouse and pig skin models, by the way. And this patch ingeniously contains both forms of HA within a single, unified delivery system.
Wait, how do they fit both forms in one patch?
So the microscopic needles themselves are formulated out of rapidly dissolving uncross-linked HA.
Oh.
However, physically embedded within those uncross-linked needles are microscopic, stable particles of cross-linked HA gel.
Oh, the mechanics of that are brilliant. When you press the patch firmly into the skin, the uncross-linked HA needles physically breach the stratum corneum and dissolve almost instantly into the dermal tissue, right?
Yeah.
Delivering that fast fluid hydration to the fibroblasts.
You've got it.
And as they dissolve, they essentially drop off and leave behind those dense cross-linked particles to sit in the tissue and provide a much longer-lasting structural effect.
That's exactly how it works. And the in vivo animal models provided stellar data.
What'd they find?
The researchers tested various formulations and discovered that a precise 1-to-1 ratio of uncross-linked to cross-linked HA provided the most persistent, optimal skin swelling and dermal hydration.
And 1-to-1, okay.
Yeah. In the mouse models, the volumetric effect of this composite patch lasted up to 4 full days.
Which is a long time for a mouse, I'm assuming.
It is. Especially when they tested a patch made of pure uncross-linked HA without the embedded gel particles. The effect of that one dissipated after just 1 single day.
Oh, wow, so 4 times as long.
Right. The composite patch effectively functions as an advanced time-to-release hydration system housed directly within the dermis.
So, for everyone listening who absolutely dreads the sight of a syringe, I have to ask, does this experimental data imply we might eventually be able to purchase like a clinical-grade patch at the pharmacy, wear it comfortably overnight, and completely avoid going in for those painful injections?
The potential for consumer application is genuinely exciting, but, we must ground our expectations in anatomical reality.
Right. Always a catch.
These composite microneedle patches show immense game-changing potential for superficial skin boosting. They could very easily replace the painful nappage technique for hydrating the upper dermis and smoothing out fine surface crinkles.
That's huge, though.
It is. However, a superficial micropatch is physically constrained by its needle length. It cannot penetrate deeply enough to bypass the facial muscles, reach the deep subcutaneous fat pads, or make contact with the skeletal bone.
So it can't fix the posterior maxillary shift.
Exactly. It will never possess the mechanical capacity to replace the deep structural bone-level lifting that requires a traditional syringe and a highly cross-linked dermal filler.
Okay, so we will always need the clinical scaffolding for the neat foundation, but we might soon be able to handle the superficial canvas hydration from the comfort of our own homes.
That's the hope, yeah.
That is still a massive win for the consumer. So, what does this all mean for you, the listener, as you navigate that overwhelming clinic menu? It means you absolutely do not have to choose between fixing deep structural volume loss and smoothing out those fine surface crinkles.
You can have both.
By understanding the fundamental engineering differences in how HA is processed, the firm cross-linked sponge cake scaffold acting as bone versus the fluid uncross-linked batter acting as a biological alarm clock for your fibroblasts, you can safely and effectively layer these treatments.
For a comprehensive, multidimensional, and entirely natural result.
Exactly.
True empowerment in an aesthetic clinic stems from an understanding of the underlying biology. Being an informed patient means walking into that clinic, bypassing the marketing jargon on the menu, and asking your provider specific targeted questions about the rheology of the products they're selecting.
Asking them about the G prime.
Yes. You must ask which type of HA they are using, what its G prime is, and exactly why they believe it is the correct biomechanical tool for that specific layer of your facial anatomy.
It completely changes the dynamic of the consultation. You transition the conversation away from, fix this one wrinkle and elevate it to, let's strategically rebuild this tissue layer by layer.
I want to leave you with a final, slightly provocative biological thought to ponder, though.
Okay, lay it on us.
We have spent this entire deep dive thoroughly discussing how to manually inject manufactured, lab-engineered hyaluronic acid into the face to replace the structural volume that our bodies continuously destroy.
Right.
Keep in mind the sheer scale of our native metabolic turnover. The fact that our bodies relentlessly break down and rebuild a third of our own native HA every single day.
The relentless cleanup crew of hyaluronidase enzyme.
Exactly. The distant frontier of aesthetic medicine may not involve injecting foreign cross-linked gels at all.
What else is there?
Consider a future where biomedical engineers successfully develop a highly localized, deeply penetrating topical treatment that temporarily pauses or inhibits the body's natural hyaluronidase enzymes.
Oh, wow. So you just stop the breakdown.
Right. If we could strategically turn off the biological cleanup crew in specific areas of the face, our own naturally synthesized uncrosslinked HA would rapidly accumulate.
Because it's constantly being made but not destroyed.
Exactly. We could potentially utilize our own native biology to permanently plump and restructure the skin from the inside out, rendering the massive menu of lab-engineered injectables entirely obsolete.
Turning off the cleanup crew so the body organically plumps itself using its own native resources. That is mind-blowing.
It's the ultimate biohack.
That would certainly make the aesthetic clinic menu a whole lot shorter and the results infinitely more natural. Until that day arrives, at least you now possess the anatomical knowledge to confidently order off the complex menu we currently have. Thanks for joining us on this deep dive, and we'll see you next time.